My name is Nicoleta Vatov, and in today's video I will demonstrate the proper technique for removing indwelling catheter. Removing indwelling catheter is a clean technique, and the most important thing is to prevent trauma to the urethra. And for the sake of purpose of educational purpose, this is the balloon that is full of water and it's inside the urethra. So to ensure to prevent trauma to the urethra, we have to use syringe. And with this syringe, we have to take all the water, deflate the balloon and take all the water out before removing. Otherwise, it would cause trauma to the urethra. The way it's done, I will demonstrate how it's done. I have covered my patient for privacy. The curtains are on so nobody can watch the procedure. I would expose only the area of where I'm going to be working with removing the catheter. I would have underneath, I don't know if you can see, I would have a pad that is waterproof in case if there is a water leakage, not to make the patient wet unnecessary. And what I would do, I would use a syringe, and I have here a cup that I can drain the syringe. Then I would go to the inflating port, which is right here. Don't know if you can see in the video. This is the inflating port, and I would place my syringe, which is empty, and I would let the gravity, as you can see, the gravity remove all the water and deflate the balloon completely. Okay, I wait until the syringe and the water is completely in the syringe and the syringe stop, and then I would empty the syringe. After the syringe is completely empty, then I would try it again. I would put it in the inflating port second time, just to ensure that there is no water left inside. Because as I said, if the balloon is not completely empty and the water is not completely out, then we can potentially damage the urethra by removing the catheter from the urethra. So now there is nothing in, and I would ask, next thing is I would ask my patient to take several slow and deep breaths, and I would be very careful and very gently and careful. I would remove the catheter from my patient's urethra. Of course, I would ensure and check with my patient and ask if there is any discomfort or if there is any pain. I would teach my patient, educate my patient that may experience a little bit discomfort or a little slightly burning sensation the next time that my patient is supposed to void. I would also talk to my patient and ensure that he or she understands that the next time the patient is supposed to void is anywhere between 6 to 8 hours, according to my professor, and according to our book, it's 8 to 10 hours. I guess it's depend. I would check the hospital procedure guidelines for this particular procedure. Then, after I'm done with my patient, I would clean the area perineal area where the catheter was. I would take my catheter, Foley catheter, together with the drainage bag to the bathroom, where I would measure by using a graduated cylinder the exact amount of urine in milliliters, and I would record it in my patient's chart. Also, I would record in my patient chart everything that I have noticed, any unusual characteristics of the urine. I would also document the color of the urine, the odor, the consistency, and of course the amount, the output of the urine. I would also document in my patient's chart what size and type of catheter I just have removed, and also how my patient tolerated the procedure. And one of the most important things is I would also write down the time when my patient is supposed to void. As I said, 6 to 8 hours according to my professor, or 8 to 10 hours according to my textbook. And I know very well from my professor that every hospital have their own standard guidelines and procedure. The way I empty my Foley catheter, it's by removing this clip, and I have a very hard time here because it's very difficult to, I would try to, okay, then this is how I would press the button. And this is how I would empty my Foley catheter completely. For the purpose of setting up this video, it's very hard, but I have imagined this glass, it's a graduated cylinder. I would measure exact amount in milliliters. I would write down on a chart, and basically that would be, I would wash my hands, remove everything, remove my my gloves, and I would document everything and wash my hands. Thank you.